So we little bit limited with option number 1 and number 2 in the way that insurance sometimes would say, oh, did you try this other medication before you can move to newer medications? And that's okay. If medication can be used and sometimes can be beneficial for multiple things, we can do it. If medication of older style cannot be used, I actually just put a letter together and explain why not. So having these options important, working with the patient important. So I can imagine case when someone coming in, and we all see in our clinics one with high blood pressure and migraine. And we do have medication which treat migraine preventively and can help blood pressure and heart rate. One of examples would be propranolol, amlodipine, verapamil, and that's perfectly fine to try as first line in someone like that. If someone coming in with low blood pressure, we cannot do it. So I would just say document, make a good note of what patients saying and what we see on neurologic exam. And that will help us to get to newer medications, which maybe have less side effects on everything. And so we're going through this steps and working around the system as we have to. I always say, please reach out to the colleagues. If you have questions, reach out to us. We do have all these wonderful programs. American Academy of Neurology creates a lot of things. I went to multiple sessions. One of them was Neurobites. So it's like little bites of information. Wonderful. And it was great to see huge interest from our trainees and doctors who just start in their career, like early career, to all these new treatments and collaboration. And in wellness, they had wellness hub at AAN. I'm very big on consulting and living lifestyle modifications. We work together with Smiles for Migraine. I just so enjoy our events, educational, but also we have upcoming actually here this year, walk, run, or relax. How great it is. Everyone asks me, are you running? I think I'm walking and just talking to everyone there, welcoming everyone. So it coming from importance of exercise. People who exercise even 3 days per week for 30, 40 minutes, articles showing that effects comparable with our strongest medications. It's amazing. Sleep effects, that collaboration which we had with sleep and sport concussion. It's so important. Sleep affects how person functioning next day for many people, but it's definitely one of common triggers for migraine when someone sleep too much or too little. So migraine likes stability. And I really recommend this, keep in mind, the seeds for success. Seeds is mnemonic provided in one of the articles by Dr. Jen Robley for lifestyle modifications. And what it included as for sleep, and then it's also the eating, how we eat, diet, hunger can be definitely a migraine triggering factor, and hydration. 1 in 3 people living with migraine report that if they don't drink enough water, they can have migraine attacks. So very important. We actually discussed a little bit flying from London to here, for example. So we say, please hydrate. So there is airplane headache, very published. And to prevent that, in addition to all this other modification, we say, many people when they go to airplanes, they try not to drink so they don't have to get up. Well, maybe getting up not that a bad idea. Move little bit and drink some water. And keeping headache diary puts our patient in control. So knowing what's happening, don't concentrate on headache all day long when possible, but at least write one number, maybe 0 to 10 in headache diary. And if you took maybe headache new medication or headache acute medication, that will help doctors and other medical providers to see what's happening. If we can have headache diary, and again, I did discuss it at my presentation, if we have headache diary, we probably will be able to have diagnosis in about 90-something% of cases in our first appointment. So that's amazing number from research.